it's Mary, your new grad nursing interview coach, and today I want to talk about the difficult patient question. So I want to make sure you guys really understand that when they use a sentence like, tell me about a time that you had a difficult patient, they want to hear about a time that you had a patient who was really difficult to work with, who was upset or who was being aggressive, and they want to hear about how you were able to address their emotional needs and turn the situation around. The reason that hiring managers ask this question is because if they hire a nurse that loves a fight with a patient and is going to escalate and turn it into a situation where the relationship between the patient and the nurse is so destroyed that the nurse can't possibly provide good care, or if the patient becomes violent, it's a safety situation for everyone involved. Oftentimes, risk management has to become involved, which is like the hospital's lawyer team. They don't want to hire that nurse, so they're basically just screening to make sure you can tell them a situation where you've de-escalated a situation appropriately or shown empathy appropriately. So this is your time to tell them a story that gives them a very clear picture of you doing that. So let me just give you an example. I'm looking back through my notes of when I was a new grad interviewing. Obviously, don't use this story because it's going to be really weird if a few of you both have this answer. But the question was, have you interacted with any patient families who were unhappy with your care? And my answer that I prepared was, I have, but I've been able to turn it around. I have a strong background in customer service because I've always chosen people-oriented jobs. And on my first shift precepting, there was a daughter who was giving my preceptor a very hard time, to the point where it started interfering with his ability to care for her mother. So I decided to try to see if I could comfort her, and I could sense that she just wanted to feel heard, and she wanted to feel some sense of control over what was happening. So I gave her a shoulder to cry on and as much time as she wanted to talk about her experience through this. And I learned that she was going through this completely alone and that her mother had suffered from a previous medical error at another hospital. And so I gave her appropriate tasks that she could do, like dabbing her mom's mouth with a towel, little things like that, so that she could feel like she was helping. She told us it meant a lot to be able to finally share with someone how much she had been through and to feel like she could finally be a part of the care team. She felt very grateful for our team after that, and things felt so much more at peace. I think the key to interviewing is asking yourself what the interviewer needs to hear, and then give them a story from your list that tells them what they need to hear. With this question, they're asking without saying it, can you see a patient who is acting out and recognize and address their emotional needs, is really what they're asking you. You want to give them concrete examples, and what it does is it gives them a visual image of the story that you're telling. People remember images. Bonus points if you can incorporate using another language into your story. But be careful, because unless you are medically certified in that other language, be sure to mention that for all medical care, you used a translator. The thing is, I speak Spanish. It's okay for me to chat with the patient in Spanish, but the minute it turns into anything medical, like assessing, educating, explaining care, I legally have to use a translator because I'm not certified. It's important that you demonstrate that you know that if you mention using another language.